Thursdays.
Thank you.
Greetings, one and all. My name is Mike Settles, and on behalf of the League of Women Voters of Elkhart County, I welcome you and I greet you here tonight for a very important discussion that we're all going to be paying attention to, and news people will be reporting to their people, and so on and so forth. I'm going to take a moment here to sell you on the League of Women Voters of Elkhart County. The three basic things that we like to do is get people who are legally eligible to vote registered to vote. I'm sure everybody can agree with that. I invite you to join the League. Number two, we believe in informing the public, the voters that vote. A good voter is an informed voter, which is why we do these events like tonight. And while I'm talking about information and such, on the papers that are at your desk, you will notice on the one side, it begins, please join us for our Meet the Candidate event Thursday, September 29th at the Middlebury Public Library. And that will take place at 6 o'clock. The address is there. Many candidates have already responded that they will participate, and so you are invited to come on out and listen to that. That is in partnership with the Middlebury Public Library. And so that's the second part that I want to sell you on, an informed voter, public. And so I invite you to join. And then the third thing that I would encourage you to join for is because we like to actually get those eligible and informed voters actually out to vote. And so if that matters to you, then also I invite you to join the League. You can do so online. Okay, there's information there. And you can also do so talking to Evelyn back there in the blue shirt. She's the person that greeted you on your way in. If you happen to go onto Amazon.com and you purchase something, there is a button for Amazon Smiles, and you can make a contribution to the League through there as well. Now, I don't want to take up any more of your time trying to sell the League to you, because it sells itself if you just know and have the information. And so what I would like to do here is take a moment to invite somebody that has served on the school board for Elkhart Community Schools a number of terms, and so she is well informed of issues regarding children and health issues of children in schools. And so I am going to invite Karen Carter to come forward, and then she will invite our speakers for the evening.
Welcome. Hello, can you hear me?
Yep.
Okay. Welcome to you tonight. This is an issue that I thought would be important for the League to shine a light on, because the rate of maternal and infant mortality is not good in Indiana, and it's not good in Elkhart. And so we have some local experts here that are going to speak to us this evening. We have Melanie Sizemore, who is the County Health Administrator. And we have Marty Conrad with Healthy Baby, is that correct? And then we have Dr. Bethany Wade, who is specializing in OBGYN. I got all the names right. So I'm going to turn the program over to them. They can tell you anything more about their credentials than I have. But welcome to our meeting, and thanks for coming.
Thank you. As she said, I'm Melanie Sizemore. I'm the health administrator for the Elkhart County Health Department. my credentials aren't really a big deal. I have a master's in public health. That's what gives me this privilege. So we're going to talk to you about infant and maternal mortality, and we're going to break it up a little bit because I'm more the expert in infant mortality, and Dr. Waite is the expert in maternal mortality. And then Marty is going to talk to you about the programs that we already have in place at the health department to mitigate our issues here in Elkhart County. So we'll start out with the basic definition of infant mortality so we're all on the same page. It is the death of a child under the age of 1, but does include fetal deaths that are 20 weeks or greater. So keep that in mind as we're going through all of this. So infant mortality causes. There are 6 main causes for infant mortality. So birth defects, preterm birth, and low birth weight, and we'll get into going in and defining each of these, but sudden and unexpected infant death syndrome, so SIDS. Injuries like suffocation, maternal pregnancy complications, and limited prenatal care. So, for birth defects, 1 in 33 babies born in the U.S. Each year have a birth defect. Some causes we know about and we deal with, and others we cannot, meaning we can prevent some, others we cannot. So causes we know: smoking, drinking alcohol, drugs, medical conditions such as obesity and diabetes, prescribed medications, certain ones can cause birth defects, genetics, infections during pregnancy. Zika virus was one of the more recent ones that's people know of. Fevers greater than 101 that give you an elevated body temperature for long periods. Being an older mother, so 40 years of age or older, can cause chromosomal abnormalities. And then a lack of enough folic acid. Preterm birth. So in 2020, preterm birth affected 1 in every 10 infants born in the U.S. So we will get into Indiana and Elkhart County. Preterm birth is when a baby is born before 37 weeks of gestation. And some of those causes are there. So breathing problems, feeding difficulties, causes cerebral palsy, developmental delays, vision and hearing problems. SIDS, this is one that we struggle with here with the health department because it does greatly affect Elkhart County. So 3,400 babies in the U.S. die every year from SIDS and sudden and unexplained infant death. So suffocation or strangulation are the main causes. So prevention is key. So this is a piece where we can educate the community and we can help people understand, moms and families understand that the babies must be on their backs to sleep, go back to sleep every time. Every time is the key. In the crib, bassinet, portable crib, or pack and play. Every time. Not in bed with them, not co-sleeping. So no blankets, stuffed animals, those bumper pads that were common back in the day, pillows, those sorts of things, not in the crib, ever. So nothing. Dress them in clothing that will keep them either warm or cool, depending on the time of year, so they don't overheat or get cold every time. So I have, and further down the slides, there's actually a picture that we'll go through. So this is part of it. So this is just reiterating, put the baby back on their back to sleep in the crib. Firm mattress is another piece of that, so you can minimize suffocation. And the key is to share a room, not the bed. This is where we often, moms that breastfeed, they're tired. Marty especially, has heard every reason in the book for not sleeping in separate spaces, but it is key to do it every time because that one time can lead to death. So, and we've talked to too many moms about that. So, some stats. This is national stats. So this is not placing the child back on their back to sleep, by race and ethnicity and age. And these are actually common stats for the state of Indiana, mainly, as you can see, There are, in race, the black race is higher. The younger you are, the more likely you are to sleep with your child or not put them on their back to sleep. Bed sharing, sort of same, it goes down the line. Any soft bedding. These three categories are the common categories for unsafe sleep. So, injuries are mainly in suffocation. So, putting a pillow, for example, in the crib with baby, the baby's not able to roll and move as much when they're 2 months old, for example. They could suffocate by having a pillow. Though that's where the bumper pads, why they tell you not to use bumper pads now. The death rates increased 20% among infants overall and 21% among Black infants. Maternal complications, and obviously Dr. Waite will get into this much more, but these are the maternal complications that can cause infant mortality. So anemia or low iron, UTI infections, mental health conditions. So I just lost it. No, mental health, sorry. So postpartum depression, and if they have other mental health issues that they may have to go off of their medications for during pregnancy, that lead them down the wrong road. And then hypertension, gestational diabetes, obesity, we talked about, infections, HIV, and I never say this wrong, but right. So it's extreme. It's more than morning sickness, but it's extreme.
Hyperemesis gravidarum.
There's the scientific words. So, limited prenatal care. This is the one we also struggle with here in Elkhart County. The goal for all pregnancies, all pregnant women, is to be seen within their first trimester. So we want them, in whatever doctor they go to, we want them to be seen. What we find in Indiana is that only 69.3% of births have received prenatal care during the first trimester. The first trimester can determine the health of the baby through the rest of the birth. So we do a lot of education during that first trimester. Marty can go into all of that as well. But for example, talking about folic acid, the need for prenatal vitamins is essential. And starting them right away, if they don't come in until they're in their second trimester, they've missed that whole first trimester of prenatal vitamins. So, here's some stats. So the way infant mortality is figured is it's in a rate, so per 1,000 births. So in Elkhart County, we have about 3,000 births annually. It does change a little bit, but it's typically right around 3,000. So the current rate nationally is 5.6 deaths per 1,000. The goal for nationally is 5.0. Indiana, Elkhart County ranks 45th in the state. So out of 92 counties, we're 45th, or I'm sorry, Indiana is the 45th state out of 50 states. We are 6.6 as our rate. The goal is 6. Elkhart County is 85th out of 92 counties at 7.9, and we, of course, want 6.0 as well. Here are some other statistics for you around Indiana. So for 2018, 19, and 20, and our stats are always behind. So this is the most recent. The State Department of Health has to validate all of the data. So this is the most recent that we have. So for preterm births, which are before 37 weeks, that's the rate. So as you can see, 10%, it's a pretty much a flat statistic. Low birth weight, same thing, very low birth weight. So I don't know my grams to pounds.
2.2.
It's like 2.2 pounds.
Yeah.
So,
The birth weight is 5.5 pounds.
okay, so low is 5.5 pounds and very low is 2.2 pounds. For free. So, So in 2020, 1.4% of babies in Indiana were born with a very low birth weight. And then moms not breastfeeding at discharge is about 8%. Of course, breastfeeding encourages not only the health of the baby, but the bonding and the connection and all of the antibodies and nutrition that the mom gives the baby. So 18% are not breastfeeding, and then our no early prenatal care, so first trimester. So in 2020, 30%, almost 31% of Indiana women did not receive first trimester care. Smoking, obviously, as we talked about, can lead to birth defects, almost 11%. And then births covered by Medicaid at almost 40%, so 38.5%. And teen pregnancies at 5%. And that actually has been slowly decreasing. So we are seeing better numbers there for the state. So birth outcomes by race and ethnicity. And again, this is breaking it down by state. So all those same categories, and then it's Indiana, and then non-Hispanic Black, non-Hispanic White, and then Hispanic. Overall, in Elkhart County, the rates are higher in the Black community, so we have work to do there. So Elkhart County. We've had basically a constant infant death rate from 18 to 21. 14 infants under the age of 1 died in 2021. And then a percentage of infants with a low birth weight was maintained at 7% from 17 to 21. Teen pregnancies has decreased by 44% from 2011 to 2021. Elkhart County's Black infant mortality rate is 23.4, while their white counterparts are 7.7. 46516 is our worst zip code in the county. So we are working to fix that, and again, Marty will talk about our program. So, and then this is just a graph showing you in Elkhart County the white, Black, and Hispanic differences in Elkhart County. So I will hand it over to Dr. Waite for maternal mortality.
All right, so the World Health Organization defines maternal mortality, or just that same that year, so death of the mother while pregnant or within 42 days of the end of that pregnancy. And then it's regardless of how long the pregnancy lasted, so even if it's a first trimester death, it's still calculated into that number. And then regardless of why that, or what caused that pregnancy death. Accidental deaths like car accidents, fires, are not included in maternal mortality. So when you're looking at when does death occur, and this is across the United States, so this is from the CDC. So most deaths in the United States, 52% happen in the postpartum stage. I'll kind of go back to that because it's different in Indiana. And then the other half is either during pregnancy or within that first part or that day of delivery. So pre-pandemic, we saw mothers dying at a rate of 17 deaths per 100,000 people. So Elkhart County is about 200,000 people, or a little more than 200,000, to kind of give you an idea of what it's like in our particular county. Now it's it's actually higher throughout the state of Indiana. But so pre-pandemic, it was about 17 deaths per 100,000. Post-pandemic, it's gone up to 24 deaths per 100,000 individuals. So when we look at why is mortality increasing, while we're seeing teen deaths or teen pregnancies go down, we're also seeing people having babies at older ages, and that's putting them at much greater risk for death. In particular, our 40-year-olds. So this would be the example of, in 2015 is the gray dot, so that's how many mothers in their 40s were having children, and as you can see, it's only increased. So this is in 2020, and then if you look at the 35 to 39, and then if you look at 30 to 34, and then above that, it's been declining. And so that's why we're seeing a portion of why mortality is increasing, because of just in general the age of pregnant women in the United States. So you can see that women who are 40 and older have a much higher rate of death with pregnancy. And so that's why preconception counseling is so very important for these women. If they have comorbidities like hypertension, it puts them at much greater risk. So really trying to get patients into the office, talking to them about, hey, this is your risk in your 40s, are you sure you want to do this? Or this is your risk, let's get you in your first trimester, let's watch you throughout the whole pregnancy to make sure you have a healthy baby. So who's affected the most? Black mothers, hands down, within the United States, have the highest risk of mortality in pregnancy. Then come American Indian, Alaskan Native women, white women then. Hispanic women, for the most part, tend to have babies later in life, all throughout, I should say, their childbearing ages, and typically have lower risk of maternal death. Now that has increased a little, and I'll show you that in a minute. So this is just another way to look at different graphs. So Hispanics being the least likely to die in pregnancy, Black women being the highest risk, and then everyone in between. So, and one more, so another, this is over time, so back in 2000 we had a pretty lower rate, but African American women, which is the top line, have always had this higher risk of maternal death. And then what we're seeing is Hispanics through the years really staying at the lower range of having maternal deaths, but now we're seeing this abrupt increase. So since 2020, we're seeing a 44% increase from 19 to 2020 in deaths of Hispanic women. So racial disparities, it persists over time. It's across all the age groups. So even if you look at the teen mothers who are Black, they have a higher risk of dying than white teen mothers. So it doesn't matter what decade of life that they're in, they're just in general at higher risk. And what also doesn't make sense about this statistic is even Black women who have completed a college education have a higher risk than individuals that are white that haven't even graduated from high school. And then among college educated or even college educated or higher, Black women are still 5 times more likely to die than college educated white women. So on to just in general the causes of death, particularly during a pregnancy. Most common are cardiovascular conditions, heart attacks, cardiomyopathies, infection, bleeding or hemorrhage, blood clots, strokes, in general just having hypertension with renal failure or kidney failure. These are the most common. So that was kind of the US data, but then I wanted to hone on a few things with Indiana's data. So Indiana has a maternal mortality review. This was started, I think, back in 2018 or 2018, right? And this was actually started by the current health commissioner, Christina Box, who is a OBGYN. So she has a close heart to maternal mortality. And so they started this committee. And so I'm going to just go over kind of the most interesting key findings that they found when they reviewed. So in 2018, they looked at all the maternal deaths that came across through our death registry. So anytime you have a death, we have to say why, we have to give, if the patient's pregnant, then they ask specific questions. And they reviewed all of these cases. And it was found that a total of 63 deaths were certainly pregnancy-associated deaths. And once again, occurred within that first year. of the end of pregnancy. So 86% of those pregnancy-associated deaths occurred in the postpartum state. So remember I had said that in the United States, usually 50% of individuals die in postpartum, but in Indiana, it's 86% that die in the postpartum phase, not during pregnancy or not while they're with child. And the frightening thing is substance use disorder contributed to 50% of these deaths. And so when a physician is filling out a death certificate, it asks, do you think substance abuse had something to do with this death? And so that was 50% of the time it was associated. And then accidental overdose was overwhelming the biggest contributing factor, and that happened in 36% of the cases. And so the saddest thing I think about this review was that they felt that 87% of these deaths were likely all preventable. So, two different graphs. This is live births in Indiana. So 71% are white, 6% African American, 10% Hispanic, and 13 mixed race. But then when we compare then who's dying, and you'll see that black women, even though they represent 6% of the live births in the state of Indiana, have the highest rate of death. So it's consistent. Indiana is just consistent as the United States that being black puts you at higher risk for death in pregnancy. So this is kind of the same thing that, so age-wise across the United States, how you are more likely to die in your 40s, that is still consistent in the state of Indiana. Most of the women that died were 40 plus. And then, so there's kind of two ways to look at pregnancy-associated deaths and then timing of pregnancy. So they kind of break it down a little bit. So of all the deaths, there were 63 in the state of Indiana. Overwhelmingly, most of them were at the end or after delivery. Versus on deaths during pregnancy or the day of pregnancy, most of the time, if it was going to be a pregnancy-related death, such as hemorrhage or sepsis, that was going to occur between days 1 and 6 after they had that baby. So, but still, postpartum deaths are when we see them the most. And then this is talking about what's the cause of those 63 deaths. So the cause here, 23 of them, accidental overdose. That's where we get the substance use disorder pulling into this. 7 were motor vehicle collisions, 6 cancer, 5 were sepsis, suicide and homicide being the last 8. And then if we were looking at was it an actual pregnancy cause to that death, it's pretty broad range. So the typicals, bleeding, preeclampsia, which is high blood pressure at the end of pregnancy, heart failure, stroke, pulmonary disease would be more like asthma, or pulmonary embolisms or blood clots in the lungs, cancer, homicide, and unintentional injury. So the whole point of this committee is to figure out how can Indiana do better. And if this is a 56-page kind of report, and then how Indiana can do better. And so I really just kind of picked out the most, I felt like, ones that, at least in Elkhart County, we're attempting to tackle. So the one thing they did see in reviewing this data was patients that are postpartum and then they've had complications in pregnancy. They were transferred to their primary care physician, but there was no physician-to-physician communication as to how sick this patient might have been in pregnancy, and so those patients were getting lost in follow-up. So really trying to improve the communication of providers within our area to try and get them to have better care for early pregnancy, during pregnancy, and at the end of pregnancy. So women that were clearly inadequately screened, referred to, or engaged in some kind of substance use treatment. They either weren't asked or could not find therapists or behavioral health specialists to be able to help them with substance use while they were in pregnancy or after they were in pregnancy. The biggest one was patients going home with opioid pain medications and mixing it with either other drugs, with alcohol, or any other substances that they might have been taking and passed away. And they also found that a lot of those preventable deaths, they felt like if those patients would have had naloxone, which is the reversal agent for opioids, that actually they probably would have survived. Emergency visits, very high, also showed these patients came in with hypertension and it was unrecognized that they had late stage preeclampsia in those particular women. And then we do not have any substance use treatment programs actually in the state of Indiana where somebody can actually go for either inpatient or aggressive outpatient care for their substance use. And so all of these things Indiana is attempting to tackle in little ways to try and improve how we care for our pregnant women here in the state of Indiana and Elkhart County. And that's not.
I don't know.
Okay, usually. But you need help.
Yeah, I guess so. So, my name is Marty Conrad, and I am the supervisor of the Healthy Babies program, which is a prenatal care coordination program started by the County Health Department in 1989. And I was hired when it was an idea on paper and a waiting list. So I've been with it for a while. Our goal is to connect people with early prenatal care, Medicaid, if they're eligible. We are a Medicaid enrollment center for pregnant women, so we can do the Medicaid applications with them, and to connect them with other supportive services. Under the Health Department, the Healthy Beginnings Division has WIC, which is a nutrition education and supplement program. Stands for Women, Infants, and Children. So pregnant and breastfeeding women, infants, and children up to the age of 5. Under WIC, there's also breastfeeding support that's available as well. So a woman coming into our office can get connected with several different services that will help support her throughout the pregnancy and the first few years of the baby's life. We at Healthy Babies, it's a social work team. Our goal is, again, to connect with people as early in the pregnancy as possible. And we do education, support, sort of emotional support, hand-holding throughout the pregnancy and at a minimum the first 4 months after the baby arrives. We try to, at that point, hook them up with other services in the area. At each touch point during the pregnancy, we are doing education on how to care for themselves, how to care for their infants, how to provide a safe sleep environment, how to get some of the resources that they'll need to keep the baby safe, such as safe beds, safe car seats, that kind of thing. We're also sort of monitoring that they're being compliant with their medical care, keeping their medical visits. Elkhart County is actually pretty resource-rich in supports for pregnant women. Healthy Babies is not the only program there. We have a great nurse-family partnership program, the community doulas, who can also, these are all other places that also do home visits with moms. So community doulas, nurse-family partnership, healthy families. We also have a couple of crisis pregnancy centers that also work with moms and young families. We're all trying to address this issue. Nobody quite knows why our rates are so poor, because we do have a lot of supports available. It's just a matter of people knowing about them, making use of them. sometimes the moms that are at the highest risk with the substance use disorder and that kind of thing are not the ones seeking services, and that's, I don't know how to fix that. So, I don't know. Either questions or, I know we have Nicole from Community Doulist here. Laura from Nurse Family Partnership. I haven't seen anyone from.
Question.
Yeah.
If someone in the jail is pregnant and has, say, a substance abuse problem, do they refer to programs like you so that they come out and they're getting services, or is that not happening?
Well, they used to, but now the jail has contracted medical providers.
Yeah. So they have internal providers, and then they typically will do referral services to like Oakland, for instance, to try and get them to have some type of outpatient medical assistance or mental health once they're released. That's the biggest goal.
But again, the substance use, moms with substance use disorders are the least likely to seek services. And, you know, they're scared.
They're telling why they're scared.
Well, I mean, there's a stigma attached to being pregnant and using, well, and using in general. But, you know, they're scared they're going to get their baby taken away, or, you know, and yeah. So, sorry, I see you like shaking your head.
For me, we've been together out over the years, you know, combating what can we do in order to, but there's a fear.
It is,
Reality is
it's very
fear,
scary.
and addressing, you know, and my hat goes off to Helping Beginnings, because we all been trying to work together to try to reduce, because I don't think there's such thing as the word eliminate,
Yeah.
you know, because it all goes back to behavior. You know, so we just kind of do the best we can by catching these moms when we can.
When we can, yeah. And unfortunately, too often they're walk-in deliveries, you know, and past the point where education is going to do, you know, much good, because they're going to have that baby, you know. So then the goal is to support, if mom is taking that baby home with her, then find ways to support that family. Figuring out what they need to keep themselves and baby safe, and trying to provide those services.
Is there a home visit, whether the mother asks for it or not after delivery? Like some countries, like France or whatever, they have.
Unfortunately, no. All the home visiting programs are, well, all the home visiting programs are voluntary, aside from if Division of Child Services is involved, then, you know, like if the child is going to be removed, obviously that's not a voluntary home visit. But,
The patients that are enrolled in the different programs within Elkhart County, they're all voluntary. So if they are enrolled voluntary, yes, they're getting home visits through that service. Now, if you are just a patient that comes to the doctor's office, is not receiving any Healthy Beginning services, no, there are no home visits involved. But those patients typically have the resources to come and go to the doctor, pick up the phone, call, ask questions. So really, the in-home services are really trying to target that community that needs that extra support.
And as she speak of that, and that would be working together in partnership even with CASP, and they ask those questions once before they leave the emergency, the hospital, if they would like to be contacted by the agency, the different resources that are available. And again, it comes back to choice.
yeah. And there was a point in time where both of our county hospitals sent a nurse out a few days postpartum, just to check on baby, check on mom. But the funding for that dried up years ago, and neither hospital has been doing that for at least 15, 20 years.
I would say once patients get into the program, like through WIC, they stick with it and continue to go with their pregnancies because they find it very beneficial. So there aren't many, I would say, people in our community that don't know about WIC that don't know about the services they offer, is whether they want people in their house. Some people find that intrusive and they don't want people in and out of their house unexpected, shall we say.
Question? Regarding pregnant women, because my wife and I eat out at restaurants all the time, and sometimes we see pregnant women that look pretty close to delivery to me, just working themselves to death. And so my question is does that create a health issue? That's the first question. And then secondarily, are there any workplace policies regarding that?
Well, certainly working long hours, and depending on what your work duties are, heavy lifting, that kind of thing, certainly adds to the stress level of a mom. But Indiana is an at-will state, and there aren't a lot of workplaces that make special provisions for pregnant women. In fact, a lot of pregnant women lose their jobs during pregnancy, just because people don't get fired for being pregnant, but they're a liability at a workplace, because if she falls or whatever, then it's going to be workman's comp, and you've got the mom, you've got the baby, and so there are workplaces that will finagle a way to get a mom off their employee list, but servers, they're carrying heavy loads, they're running around. It's stressful.
The other question is, or another question, in Indiana, if I remember correctly, for Medicaid, there's a certain financial limit,
Correct.
and it's not very high at all.
Actually, in Indiana, for pregnant women, it's fairly generous.
Okay.
A mom can make between $17 and $18 an hour,
Okay.
and qualify for pregnancy Medicaid. So that's a special category. So the income guidelines for non-pregnant and non-disabled adults are much lower.
Okay.
But for pregnant women, Indiana has done, and they recently extended the postpartum coverage through the first year, which is great. Because it used to cut off at, 30 days, and then it went to 60 days postpartum. And, people need to go back to the doctor to be checked if there's something going on. And if they lose their Medicaid coverage, they're not going to go back because they can't pay for it.
Pregnant women, particularly teenagers, are they aware of that?
Well, teenagers it's a little weird with teenagers, because Medicaid is determined by tax households. So if a teenager is claimed as a tax dependent by a parent, then it's parent's income that counts.
Okay.
Yeah. So one of the big concerns with the maternal mortality is that we have very few companies in Elkhart County that provide any kind of paid maternity leave. We have moms going back to work. I had one mom, she delivered on Friday, she was back to work on Monday because she had no financial support. She was it for her newborn, and she had a 12-year-old, No other financial support. And can you imagine go back to work at 2 days postpartum? But she had no choice, really. So, and that's got to contribute to some of the maternal complications of postpartum complications. So.
Yeah. On the low rate of people getting coverage in the first trimester, is the Medicaid eligibility and not having insurance and then getting on Medicaid, is that an issue, or can you see those people right away and get them on Medicaid right away, or how? I know it used to be a problem getting people on Medicaid.
Yeah.
And
Yes.
it delayed. Is that improved?
Well, what has improved is the Healthy Babies program has memorandums of understanding with the OB offices, and they will take any referral we send to them, they will take them Medicaid pending. We just have a good track record of getting people covered. So they'll trust us. And then once the Medicaid comes through, they can go back and bill for those previous visits.
Is that something people
So,
know? I mean, that's.
I don't know. I mean, we've been here for 30-some years. I always think everyone knows we're here, but I don't know.
I would say, no, people don't know, and that contributes to a majority of why we have late prenatal care. Hispanics oftentimes, or Latinas are often late to prenatal care, mainly because they don't qualify for Medicaid. And so they often don't want to pay that payment. They often don't realize that at clinics like Park City, where I'm at, we will discount them a very reasonable amount, so it is affordable for them to come, but they don't realize we do that till they walk in the door in their third trimester. And I usually say, why are you just coming now? And they'll say, well, I couldn't afford it. And then we always try and reiterate, but that's not a reason, at least at Heart City, not to come early. So you have the Medicaid patients. It works well because the Healthy Beginnings does have a really good track record about being able to get people signed up for Medicaid. They know if they're going to be covered or not, and then we also know that they do a great job keeping them on Medicaid and they don't lose it mid-pregnancy. So we can get those patients in the first trimester, but it's our uninsured that we don't see until they're in their late second, early third trimester.
And a mom who's undocumented, you know, the guidelines are still generous, but the coverage for an undocumented pregnant woman is, there's no coverage for the prenatal care. It only covers the hospital cost of delivery. So it's called emergency Medicaid, and you know, even moms who have it, it's not covering the cost of the care during the pregnancy, so they'll skip visits or they will skip recommended testing, or, you know, that kind of thing, because they're going to be paying cash. Plus, with undocumented, there's also a fear that it might jeopardize any chance they have of working toward citizenship too, which it doesn't, but there's that fear. So.
I wanted to know, don't you think that a lot of the reasons, when you mention the words Medicaid or insurance in today's world, it has become specifically political? I mean, so a lot of times that's a lot of what people will say, you know, I have to decide, you know, what I'm going to do, and a lot of people don't want to, or they have to before they do anything with their pregnancy because they don't know people who would help them, who wouldn't. I don't understand that either.
I would say that was probably an issue with Medicaid years ago, but now that we have 40% of the obstetrics population in Elkhart County enrolled in Medicaid, it's not necessarily, I don't see it as much as what I used to when I first started in practice.
Good.
You know, in addition to the doulas and Healthy Families and this family partnership and Healthy Babies, the programs that you know, are doing home visits and that kind of thing, we also have a couple of crisis pregnancy centers where they're doing free pregnancy testing and free ultrasounds, and they have parenting classes and that kind of thing as well. So, you know, there's a lot of ways for people to find out they're pregnant early and to, you know, to figure out what's out there to support them. So.
Just to share, because they are really working on a piece of legislation, just like they did extending Medicaid doing postpartum as well. So there's a summer session going on right now up until October addressing those issues around infant mortality in our moms. So it would behoove, just like the League of Women Voters and our legislators, to have this conversation, and that's what Indiana Minority Health Coalition is on the forefront of working on as we speak through Representative Summers and Representative Pryor. So they do have that together, so you ladies may be interested or talking with some of your local legislators, doesn't matter what cross line, because they definitely meet in order to get the session going. So that's one piece that we should look forward to, but it's going to take voices to finish getting it moved.
Yeah. And it's important to to understand that it's not just, you know, prenatal care and paying for prenatal care. I mean, these are kids that need, these are families that are going to need support to pay for daycare so that they can go back to work. I mean, daycare is incredibly expensive. It's right now the going rate for an infant is $260 a week. There's not, I mean, that's a lot. You know, so.
Are you finding, okay, let's go back to the high mortality rate for, maternal mortality rate for Black women. Do you think that there's a failure of some doctors? And I know Dr. Waite, you're very good with your patients, but you might be an exception there, because I have heard stories of a lot of friends of mine that, I mean, they go home and they're bleeding very heavily, and they're still sent home, and, I mean, that's it. I mean,
Yeah.
is there an attitude that we have to be working with?
Yeah.
Yes.
With some,
I think it's becoming more prevalent and realized within the medical community. We're certainly openly talking about the bias that we have for Black women in general. So I think I mean, the statistics don't lie. It's very clear that there's an issue. And so I think it's a matter of information and education to providers that we probably have bias. I'm sure I have bias that are non-Black. I'm Black, so I think I fit into that community and understand that community, but I'm sure the barrier that I have with our Latino patients is high, mainly because I can't speak with them in English. I have to use an interpreter, so I think we all have to realize we have bias, regardless of this, and it is something that we obviously, as a United States, has to work on. But absolutely, it is clear, and it's pervasive and very prevalent.
is the medical profession working on that actively, Dr. Waite?
Probably not, no, but I think that, I don't think that it's been brought to our attention until the last probably year to 2 years. I think COVID really brought a lot of that racial disparity talk out, and so I think we're probably seeing it more and more.
And I think it's in medical school curriculum. I think it's being addressed. So,
It is.
you know, younger docs in training will come out with at least an understanding. So,
And they do have that, they have been working on it for several years past before COVID, and making sure that there is something in place for cultural competency. And I know that we have been addressing that for many, many years, and now we finally have the attention of this legislators that this needs to be passed, this needs to be fixed, that when you leave school, that you have gone through this, because it is a serious issue, and always have been. That these ones that are coming out now go through cultural competency. Now, there's another thing for those that have that past thinking and behavior, we try to get them on board, but that's going to take local efforts as well, as the state put this into place as well.
And what about addressing, I mean, everything you guys mentioned still doesn't explain the big number differences between Indiana and the states all the way around it. Because, okay, so yeah, you were pointing out, okay, in the Black population, the mortality rates, but we're right next to Illinois, and you know, it doesn't apply to some other states that might have the same, so what is going on, what is really going on in Indiana that you think would?
There's some things I didn't touch on that are in the mortality review. One being we have quite a few OB deserts within the state of Indiana where we have patients that can travel up to 50 miles to get obstetrics care. And so the patients that are within those deserts, meaning they do not have an OBGYN, they do not have a family doctor that does obstetrics, have a higher risk of maternal mortality. And so there are other things in the background going on that the state is working on. So that's why you might see some of the billboards for My Healthy Baby, which is trying to promote those patients that are within those OB deserts to be able to get these navigation resources that Elkhart County already does. But we have a strong health department, and we have a strong program that has at least 15 different resources within just Elkhart County versus we have counties that don't have any. So the state is trying to take the counties that don't have these resources like we do and pull them in as well to get these patients into for first trimester care and get them in. So there's a lot of other things in the background that are going on that I didn't necessarily touch on. And I can give you the link to the document. It's a really interesting document about what we need to do to help these mothers.
But regardless of the state, I mean, even the state with the lowest infant mortality, the statistics still show that moms of color have worse outcomes.
And I understand that, but it's just why
Yeah.
Indiana,
Yeah.
in the middle, in the Midwest, I mean,
Yeah.
we're a Midwestern state. I mean, it's
Yeah.
embarrassment. And now that women in Indiana are forced to have babies, it's ridiculous. It's gonna get worse.
So I think some of that, which we didn't mention at all in this, is health literacy on both sides of the spectrum. So physicians don't always understand that when a patient comes in, where they lie in the spectrum of understanding health literacy. Are they low, are they high? They just, hey, I need you to take this prescription one pill a day, every day for the next 30 days, come back in. Are they compliant? Do they know? Who knows? They may not even pick up that prescription. But they don't have the resources or understanding from health literacy training to understand the right questions to ask that patient, nor does that patient understand the right questions to ask that doctor to make sure they're their own best advocate. So they're
The understanding or people are kind of afraid sometimes to ask questions because doctors, they're rushed and So that's why the programs that do provide, some support through pregnancy can help moms sort of understand what they need to be asking about and to get the answers. Why am I taking this medication? What's it for? What are the risks?
So do you guys have money right now? Do you have enough money for your programs?
No, we never had enough.
This is a state, Indiana has
Yeah.
money. Indiana has money, and that's one thing the league can do, we can advocate.
I think that, so we applied for this grant, this $3 million grant for health literacy, and this is exactly what we would have used that grant for. And that's exactly why we went for the grant. And in particular, it is to educate our undereducated individuals about how can they be healthy. And so working in Goshen for 10 years and moving on to Hart City and taking care of the inner city of Elkhart, our patients do not understand very simple concepts that you and I every day interpret and don't even think, we don't even realize. Most of our patients that I talk to on a daily basis don't understand what a carbohydrate is. To them, that word is bizarre. I can say, don't eat carbohydrates to a diabetic patient, and they will come back in and say, look, I'm trying really hard. I'm eating oatmeal every morning with dried raisins, and then I crush up 2 granola bars in it. We need health literacy in Elkhart County.
And you didn't get the funding,
The funding got declined.
and that's from the state.
That was from our county, no, that was from our county commission.
When our county, yeah.
Turn it back.
We need literacy within this community. That is what we need. We need educational programs because kids aren't learning this in school. Kids are not learning about proteins, they're not learning about fats, they're not learning about the basic needs of how to stay healthy and how to not be obese and how to not have high blood pressure.
For healthy babies, we received $30,000 this year from Beacon. The rest of that comes from the health department, and we actually had to rearrange the budget within the health department in order to continue the program because we obviously see the value in the program. So when Dr. Waite was the health officer, she helped rearrange that, and then we just continued that. But we are always at one point, Marty and her team, they were seeing about half of all births in Elkhart County. We're down to roughly 400 a year, and we were at about 1,500 a year.
And it's because of funding cuts.
It's a staff thing, you know, it costs money to have staff. So we are always applying for grants when dollars are available.
At one point in time, we could bill Medicaid for the home visits that we did. And so Medicaid funding was about $150,000 a year. And that's when we were fully staffed, we were seeing lots of babies. And then Indiana Medicaid stopped paying for any kind of case management services. So, not just prenatal case management, but they stopped paying for HIV case management and, diabetes case management and some developmental, case management, mental health case management, which is a mistake. I think if you have someone who's helping manage your case, you're going to be healthier. You're going to have a better outcome. And ultimately, the medical costs will be lower. But
the state tends to fund things for a period of time, and they get good outcomes. We give them great reports. Oh, this is wonderful. And then, boom, the funding's gone. Well, then, of course, all of that just plummets. So that's what happens. But we need to keep helping babies.
I have a question. So, the infant and maternal mortality rate for Black and brown mothers and babies has been high for countless years. So, my question is, I know over the last couple of years it's been amplified, or spotlight has been on it, but through the years when we're holding educational seminars and we're holding spaces for education, is anyone talking about and how conducive would it be for us to talk about the systemic racism and implicit bias that plays a role in it? Because even if we're doing health literacy classes and we're doing preconception counseling and education, if we're not talking about what created it and how it's playing a role in where we are today, how much of a disservice is that doing to the community? Because we have predominantly of white people here today and just a few blacks, but if we're here educating about the systemic racism, how far would that go with being that we told other people about the things and feel like have a second eye to watch for it?
Absolutely. We're just now starting to see the hospitals begin to hire the people to do those trainings and work with those physicians. So I've seen that a number of, I'm sure you guys have it. We've had it at the health department. So it's slowly starting. Not nearly as fast as it should be, and nothing ever is, but we are seeing it. So we're hoping, like, with a combination of DEI and health literacy and some of the other initiatives we're wanting to do, we'll start to see some changes.
And it has to be ongoing. As a doula, I tell everybody, you can put 1,000 doulas on the corner, but if we're not changing the structure and the policies behind the system, you're just there supporting the birth and the after, but the system and policies is really what's going to make the change in the needle on the mortality rate.
So just to reiterate that summer session is going on, and all of that is inclusive of what we're discussing, and to come out with some type of outcome through the discussion for the state, because money is needed, no doubt, to continue to support MCH, maternal child. And if you would like to take a part, you can connect with Representative Summers and Representative Pryor.
Okay.
We do want to be respectful for your time, our presenters' time, Ivy Tech's time. I want to thank Karen Carter for suggesting this topic and these people for this discussion tonight. I trust that you've had an informed meeting. I'm going to assume that everybody here is registered to vote. If anybody here is not registered to vote because you've moved into the district or whatever, I've got registration forms. See me later. We can get you registered to vote. Also, I want to say again, September 29th, Middlebury Public Library at 6 o'clock, we have a Meet the Candidate event in partnership with Middlebury Public Library. And I just want to thank you, and I want to thank you folks. It has been informative, and you're very professional, and I'm glad, yeah. And did I say that you're invited to join the League of Women Voters in Elkhart County? And you can go to, it's information on here, you can go and make a donation there as well. Anything anybody wants to say in closing?
Please take some goodies on your way out.
There's a lot of goodies back there. Please load up and take them with you. And with that, I say have a safe evening driving home.